Welcome, everyone, and thank you for joining us today for the Policy Design for Caregivers by Caregivers session. My name is Taiji Hill. I am with the Health Leads team and excited to see all of you here today. As we get settled, we're waiting for folks to join. I am entering a question in the chat. Please take a moment to look at the question, enter your responses, and look at the responses of your fellow attendees. And we'll get started in just a moment. Okay. So to what extent have you been engaged in policy development related to caregiving? And if you haven't, you can just put none. And while you all reflect on that question, thank you, Adriana. No, okay, see none. Great. Okay, so I see there's some. Wonderful. All righty, thank you all for responding. We're going to jump in with a few housekeeping items and then we will get started. Next slide, please. Thank you. If you all could take a moment to identify your preferred gender pronouns. You can do this by going to the top of your box, so where you're represented, and where you see the 3 dots, click there, then choose rename. And then you can put your preferred gender pronouns in parentheses right after your name. So this could be she, her, hers, they, them, he, his, or him. That way we'll be able to address you as you prefer to be addressed. And if you are on your mobile device and not able to rename yourself, please just enter it in the chat. Okay, and I'd like to remind us of our practice agreements as well. So please be present and accountable. We know there's a lot happening right now. Some folks are at home. We may see appearances from children or pets, which we welcome. But as much as possible, please try to be as present as you can. Be brave and be inclusive. Take space and make space. So if you find that you're taking a lot of space, asking a lot of questions, sharing a lot, please try to step back a bit so that others can share as well. And if you haven't shared, please be brave and share. We love to hear what you have to share. And then address racially biased systems and norms. So please keep that at the center of the conversation and how we approach the challenges and opportunities we discussed today. Great, so on that note, I am going to turn it over to Karen, who will be our moderator for today's session.
Thank you, Taiji. Welcome, everyone. Again, my name is Karen Marshall. I'm the Director of Advocacy and Engagement at the National Alliance for Caregiving, where I have the privilege to work with a network of caregiver advocates, many of whom have lived experience as many people in the audience, as caregivers, as many people in the audience do. So I'm delighted to spend this time with you today and grateful to all who joined this session on policy design for caregivers by caregivers. Before we jump into the session, I'll offer a few comments on who caregivers are and why it's important to engage them in policy design. But first, I'd like to thank Health Leads and all of the caregivers and organizations, employers, funders, and other allies who not only helped convene and design this summit, but also appropriately recognize that often those most impacted by policies are not engaged in the policy development process, whether it's in the context of institutional or governmental policies. And this is certainly true of the over 53 million unpaid friend and family caregivers who, like many of you, provide assistance with a variety of activities of daily living. Things like eating, bathing, household chores, traveling to and from medical appointments, managing medication, or generally coordinating care for a relative, a friend, or a neighbor. Caregivers form the backbone of long-term care in this country, and the estimated value of the care that caregivers provide is over $400 billion. For around 20 years, I myself have either been a caregiver, worked in caregiver support, and now I'm a caregiver advocate. But not that long ago, I recall needing to explain who caregivers are and what they do in nearly every setting I entered, and often to people who were actively and regularly engaged in caring for a family member, friend, or neighbor. They just didn't self-identify as caregivers because caregivers don't necessarily have formally recognized roles in traditional health and social systems of care. They simply identified as sons, daughters, spouses, relatives, friends, or neighbors caring for someone important to them. The caregivers serve a valuable role in society in addition to their very important personal relationships. Caregivers are vital members of the health and social care teams, and they provide unique insights and observations on the patient experience that not only inform the rest of the healthcare team, but also support continuity of care at home and between medical visits. The care they provide even helps reduce hospital admissions. Caregivers help relatives, friends, and neighbors navigate complex systems of care despite lacking formally recognized roles. And they navigate and operate in systems that are traditionally designed to serve other populations and not necessarily family caregivers. Doing so often requires time away from work, departure from the workforce altogether, significant out-of-pocket expenses, that can reach $7,000 a year, even more if you're a long-distance caregiver. And caregivers provide care often while experiencing significant reductions in savings and lost retirement, or at the expense of their own health and well-being. According to research published by the National Alliance for Caregiving and AARP, over 23% of caregivers reported that caregiving made their health worse. Caregivers are at risk of poor health outcomes, even as the demand for their care is expected to increase dramatically for decades to come. The public health implications of caregiving have only been amplified as family caregivers have stepped in to fill in gaps in services caused by the COVID-19 public health emergency. But a lot has changed since I first became a caregiver a couple of decades ago. Over the years, I've observed more and more caregivers self-identify and share their experiences. And although more progress is needed, I find it no coincidence that the role of caregiving is increasingly recognized by society, and caregivers' voices are increasingly engaged in everything from governmental and institutional policymaking to clinical research and medical product development. We're at a unique time in our nation's history. We're strengthening the infrastructure of networks and services that support unpaid family and paid professional caregivers, as well as the families for whom they care, has become a key policy issue at all levels of government. During the first 100 days, the President has proposed and Congress is currently drafting legislation that would not only strengthen the direct care workforce that's so crucial to helping families, including family caregivers, thrive, but would also help protect the financial security of working family caregivers. And as these policy discussions continue on these issues and beyond, it's more important than ever that caregivers' voices and experiences are elevated and provide valuable input to make it easier for the generations of caregivers to come, as well as our current generation of caregivers, to navigate health and social care systems without jeopardizing their health and financial well-being, the well-being that helps them offer their most resilient, supportive selves to those in their care. So to help encourage that engagement, Health Leads has convened an excellent panel today to provide examples of caregiver engagement and policy development and guidance on how to ensure inclusion of caregiver voices and diverse collaboration. There'll be time for the audience to engage and ask questions after the panelists share some comments, but for now, I'm pleased to introduce you to our panel. First, we have Chanel Perche-Albert, who is the founder and Chief Operating Officer of Ancient Song Doula Services, which is a reproductive health organization focused on providing resources and full spectrum doula services to women of color and marginalized communities. Her work has taken her across the globe, from Uganda, where she served as a maternal health strategist in rural war-torn areas, to New York City, where she has served as a consultant for the Department of Health and Mental Hygiene. And her work has taken her across the nation, serving on various advisory boards. When she's not working on legislative policy or facilitating workshops, you can find her spending time with her 6 children. Today, she will share an example of how a policy that is designed without the input of those who will be impacted by it can actually end up having an adverse effect. Beth Doretsky is an Associate Director of Programs at Family Voices, which is a national family-led organization that works to help families at the center of children's health care. Her work focuses on assessing and demonstrating the value of family engagement in health policies, programs, practices, and services as a way to improve healthcare outcomes for all children. To that end, she developed a family engagement systems tool that healthcare entities can use to assess how well they provide the supports families need to meaningfully engage in systems level initiatives. Today, she will tell us more about how this tool is used to engage families in system change. And finally, we'll hear from Greg Link, the Director of the Office of Supportive and Caregiver Services with ACL, the Administration for Community Living, U.S. Administration on Aging. ACL oversees programs funded under the Older Americans Act, including Title IIIB in-home supportive services, the National Family Caregiver Support Program, as well as ACL's Alzheimer's disease programs. He and his team provide general oversight and technical assistance to the Aging Network on a range of program areas, including family caregiver support programs and policies. And we at the National Alliance for Caregiving have been honored to work closely with ACL, and I'm thrilled that you'll hear how they're engaging family caregivers in designing policy recommendations that not only recognize the value of caregivers, but will also help expand and improve the delivery of supports to them and their families. So Chanel, the floor is yours, and after your comments, could you please pass the baton to Beth, who will then pass it to Greg.
All right, thank you so much, Karen. And thank you so much for inviting me to be able to be a part of the National Caregiver Summit. I am going to share my screen. Let's see. Greetings, everyone. So I'm going to talk to you a little bit about one of the policies that came up for Ancient Song in New York State in regards to doula work. And so the campaign that we came up with was Beyond Birth Work, support community-based doula organizations that are working towards bridging racial disparities in maternal mortality rates. And so just to give you a little bit of background on Ancient Song and who we are, we focus on the whole and not the parts through community advocacy, reproductive birth justice, and education. And we aim to tackle some of the issues affecting communities of color. Through a reproductive justice and birth justice lens, we are addressing the maternal mortality and morbidity through training, policy, and offering direct services to community for pregnant and parenting individuals. Our work because of this one particular campaign, has really branched out into advocacy and education. And so our advocacy work comes in the form of policy reform, campaigns for equity and maternal health workshops and conferences. And our goal is to shift the narrative and address implicit bias and racism within maternal and reproductive health. And we do this through educational workshops and the conferences and trainings that we provide. All right, so the process. So a lot of the things that came up for us came out of this process of understanding legislative process, community and action, and listening to stakeholders. And, you know, the basis is legislative, or what we call education and community education process. And so a bill was introduced, Bill A364, and A is for Assembly and S is for Senate. And it was introduced respectively by the co-sponsors, Paulin and Ramos. And the summary of the bill basically was set in which it stipulates that each doula enrolled in Medicaid reimbursement must be a certified doula. So if you know anything about caregiving, most times traditional caregivers such as a doula we're not licensed providers, right? We're individuals who come into the home, who offer emotional and physical support, as well as information so someone can make an informed decision about their care. And all of our work comes from a non-medical perspective. And so the introduction of this bill was really stipulated in certifying doulas through the state. And, you know, our immediate reaction was, well, one, did you speak to anyone? Two, did you, when you start to put in certification and then you have regulations, and what it would do is it would impact the ways in which doulas, which is another form of a caregiver, would be able to provide services, but also how those who were receiving those services would be able to access them, and they're already very limited. And so certified doula means a continuous emotional and physical support person, and it's someone who supports throughout labor and birth and intermittently during the prenatal and postpartum period. Certified doula means certification conferred by a health administrator. They wanted to put in a fee in order to have that done, completing certification specified for the state. And so each organization, doula certifying organization, has their own certification that they have. That is a rigorous process, and then it was state defined. So it means that someone had to be of good moral character in order to be considered appropriate for being certified as a doula. One of the biggest things that we found with those challenges is one, understanding that the role of the community-based doula is someone who lives in the community, works in the community, and is serving people who live in their community. So which means that a lot of them were across the economic spectrum, may not have access to be able to pay for a certifying fee, may not necessarily have the educational level to meet a statewide certifying test and being regulated. Also, someone of good moral character meant that anyone who may have been previously incarcerated, who wasn't incarcerated for a harmful crime, would thereby be completely eliminated from being able to access and work as a doula, thereby cutting off our economic workforce and life stream for someone who would be working. And so we got into partnership with other community-based organizations such as Carriage House Birth, Manhattan Birth, Bronx Doulas, and many more to provide statewide listening sessions throughout the state of New York. And so we literally, lugged around, and our aim was to educate birth workers in the communities that they serve on the legislative process so that they could self-advocate. And our first event took place June 25th, 2019. I'm sorry, I don't know what's happening here. 2019. And since then, doulas and birth workers have hosted educational events in Brooklyn, Manhattan, Long Island, and Bronx. And again, it was to bring forth an awareness of how political systems function and how these bills might affect the birthing communities that they serve. Ooh, I went too far ahead. From the community feedback that we received, and these were some of the questions that we asked: how will the New York State certification process affect current and future doulas? How was the community engaged handling the legislative process? How might the certification affect birth workers? And so again, these are the requirements that the state was asking for. And many were unaware that these bills until their passage. And so, we were notified about the bill going to the floor on a weekend. I went up to Albany the very next morning. So I found out about it on a Sunday. I went on a Monday. while I was speaking to one of the co-sponsors of the bill, and I was right next to the assembly floor, it had got voted on and it passed while I was sitting there talking to them. And I was like, who did you speak to? Did you talk to anyone? They were like, no, we used information that we gathered, research that was done by our team, and it was put together. And I was like, well, this is not good legislation. And so despite the legislation's direct impact on community-based doulas and the families and communities that they served, they still wanted to move forward with it. And again, so we used our collective voices to create the campaign Beyond Birth Work. And it was a call to action to support the work that we do and to maintain the autonomy of the community-based doula, who was, again, working within marginalized communities, who, is working within the communities that they live and they work in every single day to really center them. That community, that turned into a digital campaign in which we really used the images of the communities that we worked with to really bring forth and convey the messaging of like, what does this mean? How does it impact you? We wanted to make sure that people had a full understanding and that their voices were encompassed within this whole process. We also hosted a town hall. And so one of the ways in which to be able to, really get the legislators, the policymakers to get involved with community was to have this community town hall in which, the co-sponsors of the bills came. Well, not all, I would say the majority of them came. One of them did not show up and refused to come, which I found to be very interesting, especially when you have a bill that is affecting your constituents. But two of them did come and it was recorded and we placed it online for community members who, couldn't attend. And we really wanted them to be able to ask them directly and for legislators to get a feel of what does it mean for people to be working and acting as caregivers every single day and providing services within their communities. And so we defined, based on the work that we did, the responses were that, instead we wanted to really clarify to whom bills apply and distinguish between state certified doulas and doulas certified elsewhere, offer opportunities to train with and establish certifying bodies instead of collecting fees, fund Black women-led doula organizations, not create state-controlled programs, and focus on ending structural racism in medicine instead of regulating doulas. And some of these recommendations were, that we have in terms of just doing this work was lead with community in mind. And so always be humble, take a humble approach to care. Any bill that's going to come forth really needs to come forth from a place of community informing said policy, not the policy informing community. Don't assume, because education is key. And so if you find out about a bill as a community-based organization or a caregiver who's doing this work, don't assume that other people automatically know about it. Host listening sessions, host town halls, really get the voices of everyone, and not just within your little catchment area, but broaden it out and get other people involved. Organizing always starts with an ask. And so even though you may not know other community-based organizations, like we have strength in numbers. And so it's really, really important for us to come together collectively in order to have our voices be heard. And know your district and legislators, like regardless of whether you're into policy and you're not, or whether you're not, it's just really, really important to know like who's in your area, who are the assembly people, what's your city council, what's your community board look like? What are the things and how are they supporting you, right? Do they really understand the work that you do? Because what we've learned is that oftentimes they have no idea, about the work that people actually do and what it encompasses and how it can have, these unintentional consequences that can come up. And let your campaign reflect the community that you're in. Always be genuine to, your community, to the folks that you serve. If you know that it's a very diverse community with multiple languages, making sure that you have information in those languages to be able to serve that community. And don't let up, you know what I mean? Like what was really successful about our campaign was, although it got passed, both of the bills in Assembly and the Senate, we were able to get it vetoed. And a lot of that was just based on us never letting up. We had folks calling the governor's office every single day. We did phone banking, we got postcards. We were like, throwing the postcards at them. sign-on letters, really using social media as a tool to be able to center community voices. And so a lot of it is centered in community awareness, education, and then legislation, not legislation and then community. And I think that if we, and it starts well with a conversation. So if even if you see something that has to be done, and you don't know, all bills, come from an idea of someone and then it's drafted up and put together. If you have an idea, put it together, present it to your legislators, get them to understand the work that you do, and how it impacts the lives of those who you support every day, and just keep at it and don't let up. Thanks.
Thank you so much, Chanel, for these comments and these great tips and advice. So appreciate it. Beth, we'll turn it over to you now.
Thank you. You can go to the next slide, please. As Karen so nicely introduced the organization that I represent. I just wanted to say that, and Karen, also, thank you for setting the stage for the importance of family engagement, especially in where policy and practices and services are designed. You too, Chanel, because at this, it's a really critical time to make sure that the lived experience of the people who are at the receiving end of policies and practices are actually engaged in designing what that looks like, as Chanel's examples so aptly illustrated. So the next slide, please. So family engagement works to promote family engagement at all levels of the system of care. So both in decision making, when families are talking to their providers, any kind of provider, medical, school folks, caregivers, anyone, other caregivers, that they are partners in decision making about whatever the services are going to be. But it's also critically important to engage families at the systems level where policies and practices and services are created or implemented. In fact, it's a missed opportunity to not include families. So there are a lot of ways to assess to assess families as partners in decision making at the individual level of care, but not so much, but there were no tools to assess family engagement in systems level. So to fill a gap, Family Voices created a family engagement in systems assessment tool and a family engagement in systems assessment toolkit. And so next slide, please. Those materials are organized into 4 domains of family engagement. And so one of the really important, some of the really important things about being committed to family engagement is having a policy about family engagement. So as Chanel said, these legislators created this bill for doula certification. And you would think that while they might not have, you would think that elected officials would understand the importance of actually having it be their own policy about engaging, about that it should be their policy to require that they speak to families as they are creating this policy to make sure, just as Chanel said, that they are not creating barriers to the service, such as doula services, but that they're being as inclusive as possible. So the importance of having a policy is that it sets a standard that families need to have a role in creating or improving the policy, and it ensures that the policies are family-centered and equitable. There are some other, some of the other things that's important in creating policy is that there should be a champion. So you would think that the legislators themselves would at least would themselves be a champion of leading the way for talking to their constituents and the people served by the people who either provide the doula services or are served by this or will be served by the legislation will be served by the policy will be engaged. And the other thing that we've found as part that's really important as far as the commitment domain is that families should be compensated for their time, so that if everyone else around the table is getting paid for their time, then families should be too. And separate from the example that Chanel shared, when the COVID pandemic hit, a lot of state agencies stopped providing the in-person services or even some of the training that they were going to provide, and some of the in-person leadership training that they were going to do. So what they did is they arranged community calls. They arranged community calls, and everyone on the line were paid. They engaged family leaders, but they all had professional positions at the places that they were working. And they realized that they were not hearing from the families that were actually dealing that were working really hard to deal with the circumstances of the pandemic. So what they did is they reached out, they found money, and they took the money that they would have normally spent on training, and they used it to not only compensate diverse families and to hear the voices of families that were not in paid positions to be family leaders. And they also found that everybody really needed N95 masks. And so they retooled how they were going to spend the money for in-person training to actually meet the needs of families. And the reason that they could meet the need is because they actually included those families that they needed to hear from the most. Also, providing a stipend for families' time to participate on decision-making groups is an equity issue, because this group looked around the table and they realized that everyone was white, middle class, and being paid for their time. Not everyone can afford the luxury of participating in systems level work. If they are in systems level work, if they have to take time from other work, or especially when they're at home and also educating children who are in virtual school now. So next slide, please. So this next slide is, one more slide, please. Thank you. So this slide and the next few slides just show an example on the left of what the tool actually looks like and some of the items, and how we paired and how in the toolkit you can find a paired strategy and resources for how to better support, to engage families in a more inclusive way. So this one happens to be about budget, and then the example from the toolkit explains how you can create a budget line item to compensate families for their time. Next slide, please. The other thing that I wanted to, one of the other domains is transparency. And again, if the legislators, as Chanel shared, if the legislators had been transparent and had put information out about either the fee, for example, the fee that they were going to charge doulas, or the certification that they were going to expect, or even how they were going to the whole idea of saying good and moral character, if they had been more transparent about that, or if they had actually engaged families in listening sessions before they designed the bill, they would have heard from families directly that was going to be a barrier, and it would have helped. If they still wanted legislation, it would have improved the legislation to make it more equitable. Next slide, please. And so again, this is a paired section of the toolkit alongside the strategy, and it talks about the importance of supporting families with the of how to have groups work together so that they can create a shared understanding of the work that they are going to do together. Next slide, please. The next slide, this is a really important domain too, is representation, in that the families that are engaged in the work need to be representative of the populations of families who will be served by the initiative. And the next slide again shows The next slide again pairs, like if a place is if an organization is having trouble engaging families that are going to be served by the organization, especially of different race or ethnicities. One of the strategies that you can use is to connect with community liaisons, cultural brokers, family-led or community-based organizations. And then we've given some resources about how you can do that. Next slide, please. And then the last domain for the tool is impact. And basically, impact describes how and where an organization used families' input and ideas to improve existing policies or to create new ones. And so it's really important to listen to families, know what works and what doesn't work. And it's really important to listen to their lived experience, to work to identify areas of improvement, and to work together to identify solutions. Next slide, please. Well, the next slide will show the impact, again, shows an element from the toolkit and paired with a strategy. Next slide, please. These tools can be used 3 different ways to plan how to engage families in work that an organization is first setting out to do, or that legislators are setting out to do, to assess how well they're engaging families. Do families have the information and supports that they need, and how you can improve family engagement. Next slide, please. And these tools are available for free. We also provide free general and targeted technical assistance for use of the tools. Thank you. Greg, and I'm going to hand it over to Greg.
Great, thank you, Beth. And I just want to extend my gratitude to Health Leads for giving ACL the opportunity to talk about work that we've been leading now for the past couple of years on a national effort to establish a national family caregiving strategy. I'm really pleased to be able to work for an entity within the federal government that is who supports a local, services and delivery network for older adults and people with disabilities and their family caregivers. I've worked in this network of the Aging Services Network for more than 30 years. And so I've seen firsthand the value of support of the input of older adults and families in the shaping of programs, services, and policies at the local level, at the state level, and now finally at the federal level through our implementation of the Recognize, Assist, Include, Support, and Engage, or RAISE Family Caregivers Act. Next slide, please. So I want to just give a little bit of a background on the RAISE Act and what it's about and what we're doing, and then present some examples to you of how the work that we have been doing over the past couple of years has at every step of the way engaged family caregivers in the process of implementing the requirements of the RAISE Act. So the Act became law in January of 2018, and it contains 3 elements or 3 requirements to be fulfilled by the agency leading the implementation, which is the Administration for Community Living. The first is the establishment of a Family Caregiving Advisory Council, and I'll go into a little bit of detail on how we did that. The second element is an initial report to Congress with updates every couple of years, and then the development of a national family caregiving strategy. So 3 key elements to the RAISE Act, and the current anticipated sunset for the Act is 2022. So we have about a year or so left in our work. Next slide, please. So the RAISE Act is focused on family caregivers. However, the work of the Family Caregiving Advisory Council also recognizes the very important role that the paid workforce plays in supporting family caregivers. But for purposes of defining family caregiver, the Act takes a very broad approach in defining the term family caregiver, and it means an adult, family member, or another individual who has a significant relationship with or provides a broad range of assistance to an individual with a chronic or other health condition, disability, or functional limitation. And so the focus really, as I said, is on the unpaid family caregiver, but it is a very broad interpretation of who could fill that role. Next slide, please. So the first deliverable of the RAISE Act is this initial report to Congress, and I'm really pleased to say that last week, the Family Caregiving Advisory Council's initial report to Congress entered formal clearance. The Act is very specific about what that report is to cover. It's to look at the range of federally funded efforts to support and recognize family caregivers, and the report also contains a slate of 26 recommendations, and I'm going to delve into those in a little bit. It looks extensively at some of the health, financial, and other challenges that are faced by family caregivers, along with the existing approaches to address them. And many of the recommendations that the report contains are directly address the challenges that family caregivers are facing, and we engage in a very public input process to help really get our finger on the pulse of what those key challenges are. And then finally, the report takes a rather in-depth look at how Medicare, Medicaid, and other federal programs are currently supporting families and family caregivers, and points to some opportunities to strengthen some of those activities. Next slide, please. The second element of the RAISE Act is the development of a national family caregiving strategy. And so that strategy is to be developed jointly by both federal agencies and the members of the Family Caregiving Advisory Council. It identifies actions that can be taken at the federal, the state, local, and community levels, as well as by health and long-term services providers and other sectors such as the faith-based community, philanthropy, you name it, to better support family caregivers. So it truly is a national strategy. It's not simply what the federal government can do, but what together we as a nation can do to come together and better support and assist family members. It has to reflect the diversity and the diverse needs and the diversity that is the family caregiving population, and it will be submitted to Congress, and we believe will serve as a very cogent roadmap for us as a nation to better address the needs of families. And that strategy is going to include the following components. So if we can go to the next slide, please. The strategy is going to promote or will articulate actions that can be taken to promote greater adoption of person and family-centered care across settings, actions that can be taken to improve our assessment and service planning for families, actions that can be taken to strengthen how we inform, educate, and train family caregivers, respite options, financial security and workplace issues, as well as improving service delivery and eliminating redundancies across programs. Next slide, please. So we have made a very concerted effort to engage family caregivers at every step in the process since we began implementing the requirements of the RAISE Act. The first was in the establishment of the Family Caregiving Advisory Council. We did a public call for nominations. The RAISE Act says that there have to be 15 non-federal members of the council represented on the council, and they come from a number of different backgrounds. There has to be a family caregiver. There has to be an older adult who needs supports, a younger person with disabilities who needs supports, as well as a range of professions represented. I can tell you from working with the non-federal members over the past couple of years, all 15 of them have been caregivers or are currently family caregivers in some capacity. Additionally, all of the meetings, the meetings of the advisory council are open to the public, and we have anywhere from 150 to 200 members of the public tuning in to watch these meetings, which happen about every 3 months or so. Many of these folks are family caregivers, and we obtain a great deal of information and input from the folks who tune in to watch these meetings. To inform our development of the report and to understand the challenges that family caregivers face, as well as begin to get a sense for what the recommended actions might be to improve the lives of family caregivers, ACL issued a request for information that covered the span of about 2 months, from December of 2019 to February of 2020. We got over 1,600 responses, 75% of which came directly from family caregivers. And we asked very simple questions. What current challenges are you facing? What would you like to see improved programs and services wise? What is the most burning issue you have as a family member? We really wanted to hear what the needs of family caregivers were, and they told us very loud and clear. The information that we got from this request for information was then delved into a little bit more deeply in a series of focus groups and listening sessions with family caregivers and aging and disability stakeholders. And the result of these focus groups and listening sessions were very, very concrete actions that the Advisory Council will take into consideration as they're beginning to develop the national strategy. Next slide, please. So back in November of 2020, the Advisory Council adopted a slate of 26 recommendations that fall under 5 broad priority areas. Those priority areas or goals look at awareness and outreach to family caregivers, engagement of family caregivers as partners in the health and long-term services and support systems, direct services and supports, that's by far the largest category, financial and workplace security, and improving our research data and evidence-informed practices. And the recommendations, the 26 recommendations that the Council adopted in November are forming the foundation of the National Caregiving Strategy. So if we can go to the next slide, please. On this slide, I pulled out 6 of the 26 recommendations to share with you to give you a sense of their breadth, but also to highlight the fact that many of these speak directly to directly engaging family caregivers in both services delivery, systems change, program development, what have you. Especially, I would point you to the first recommendation in the right-hand column, which is a recommendation to ensure that the impact of policy and practices on family caregivers are studied and understood before changes are made in healthcare systems. We oftentimes hear that, you know, a hospital or what have you, maybe, you know, develops a policy, or, you know, a state will craft a policy or a program around the needs of families without ever really consulting families, similar to the issue that Chanel brought up. So there's a broad recommendation, and we're going to see a series of concrete action steps that can be taken at the federal, state, local level, where have you, to make sure that caregivers are more included all along the way. If we can go to the next slide, please. We're currently, as I had said, the initial report is in clearance, and it will be, once it's approved by HHS, it will be sent to Congress and publicly disseminated. And we are currently underway in developing the National Family Caregiving Strategy. Next slide, please. For those of you who are interested, you'll have access to these slides. You can check out all of the work of ACL and the Family Caregiving Advisory Council. There's active links in here to the statute, to progress reports, to the recommendations, as well as some companion work that we're doing to really focus on the needs of kinship and grand families. Next slide, please. And that is my contact information, and I understand that we are out of time, so I will turn it back to Karen for Q&A.
Thank you so much, Greg. And thank you also, Beth and Chanel, for fabulous presentations. You've certainly given us a lot to think about and a lot of tips on how to effectively engage caregivers for more impact in our respective work. So I see that we've had some questions come in, and I think the first question is specifically for Beth. Do you know what types of organizations have taken up the tool you developed, and what have some of the organizational drivers been for them?
So if by organizational drivers you mean why they decided to use the tools, it was mostly because there was an expectation that that these organizations would engage families. So we have Family Voices staff have done a lot of work with the Children with Medical Complexity COIN. And that group, based out of Boston University, actually required the use of the family engagement and systems tool when they had first start, because there is a family expectation that they will engage family partners in their work. So these might be hospital systems, payers, Title V programs, and that there was an expectation that they would have families on their team, families on their teams to help them with their quality improvement work. It might be redesigning workflow in specialty care clinics, or it might even be, payment. So, so that was a requirement, and they used the tool over time they did an assessment to sort of set a baseline, and they used the tool again over time to see where they had made improvement. And we provide Family Voices staff acted as coaches to the teams to help them understand their results, and to, because this is part of like targeted technical assistance, and to help them with action plans for improvement, and even called out some things, some of the resources in the toolkit that could help them. We also, the Early Childhood Comprehensive Systems COIN team has also used it. We have several Title V programs that are using it to engage families in work. In one state, they're working on engaging youth and families in the to sort of revamp the transition process for youth from pediatric to adult systems of care. And we also had a group there's a checklist in the back of the Family Engagement Systems Toolkit that matches the items in the actual assessment tool that organizations can use to sort of to plan family engagement. Like they can look through the items and say, like, do we have a champion? Do we have a written policy? You don't have to have everything in every domain, but you can also just like work one domain at a time. But one of really, as I had mentioned, one of the critical things is families are also professionals, and that they need to be compensated for sharing their time and their expertise. So if everyone else sitting around the table is getting paid, families need to be paid. So we get a lot of questions about how to build line items into budgets so that families can get some reimbursement for the time that they are spending doing this important work.
Thank you, Beth. It's just so helpful to have a tool and have some guidance on how to be able to not only to just think about these issues, but and think about this engagement, but to execute the engagement in a meaningful way. We're seeing a lot of thanks in the chat for the presentations and the answers to the questions. Next question, what is the biggest, and I think this is applies for all of the panelists, what is the biggest challenge you hear or experience for not engaging caregivers, and how do you respond? Perhaps we can begin with you, Greg.
So I think it's the biggest challenge actually is the missed opportunity that you have if you, or that would be present if you don't include the voices of not only family caregivers, but the people who need their support. There's a saying in the disability community, I think we saw it on one of Beth's slides, nothing about us without us. And that applies so universally across all populations. You can't craft good policy without the inclusion of the people that policy is meant to touch. And so, I would say as family caregivers who may be listening, you have the opportunity in your own communities to get involved in the policymaking process. If you are connected to, your area agency on aging or your centers for independent living, look to see when they're having public hearings and meetings to be, that are open to the public where you can get your voices heard. And become part of that process. Every state and every area agency on aging every 2, 3, or 4 years develops their state and area plans on aging. Those have to be derived from public input, including that of family caregivers. And so there's a real opportunity at every step of the way to be make sure your voices are heard. And I think where that's lacking, where that opportunity isn't oftentimes taken full advantage of, you find programs and policies that may generally be lacking in areas. So that's my 2 cents.
Other comments? Anything to add from the other panelists? I will jump in and add one thing. a few of you have mentioned that either in terms of the organizational drivers with partners that you worked with, or in Chanel's case, underlying legislation that you were working with, there was research that helped drive the development of those policies, the development of those actions, for good or bad. So I think this is also a good opportunity for researchers to think about, not just policymakers, but researchers to think about how they're engaging caregivers and informing what they do, since that will ultimately help drive policy. So we have a comment and a question. There's a bit of an excuse flying around that it's difficult to get caregivers involved because they are busy caregiving. Have you found this to be true, or is it used to continue to exclude their voices?
I think it's sometimes used as an excuse instead of saying it's difficult to get caregivers involved. Like, why not create times where they can get involved? You know what I mean? So like understanding they may not necessarily be able to engage like during the day. So like, what does it mean to have meetings in the evening? What does it mean to have conversations on the weekend? What does it mean for conversations to be recorded? I know as a mom, and I think that's the ultimate caregiver sometimes, a parent, I can't get a lot of work done until, after everybody has gone to sleep, you know what I mean? And that's when I can really focus and engage. And so, yeah, I think it's a matter of policymakers not trying to get community to conform to their time, but them realizing that you work essentially for the people. And so what does it mean for you to meet them where they are, not where you expect them to be? And go to the places where they are. If you know that they have to work all the time, then what does it mean to, have them be present? But also, like, if it's involving children or it's involving people who are disabled, like having the necessary resources available so that they can engage. So if you want children to, if you want to engage people who are working with children, what does it mean to have childcare available at the meeting that you're providing? What does it mean for there to be, accessibility entrances for people, who are in wheelchairs or who are using strollers? What does it mean to provide transportation for elders to get from point A to point B, as opposed to, expecting them to find a way to be able to get to you? So again, it's meeting people where they are, not where you expect them to be, I believe, in the work. And that's how you really can, get involved with community engagement. It's not the other way around, because that actually also never works.
Chanel, you absolutely took the words out of my mouth. We engage by meeting caregivers, meeting families where they are. I see that we're at our time, so I just want to stop and thank the audience for participating today, for the excellent questions. Thank the panel for lending your expertise, and I want to thank the Health Leads team for arranging this summit for us today and this opportunity to talk about caregiver engagement. So I'll turn it back over to Health Leads. Thanks again for attending.
Taiji, you're on mute, I think.
Thank you. Thank you, everyone. Thank you, Karen, Greg, Chanel, and Beth, for a great session and for all the work you do to advocate for caregivers. We are going to break now and head to our next session. Everyone, please take a moment to fill out the survey. You should have received that not too long ago. And just a correction, the policy session, the next one will actually focus on quality of life for caregivers and care. Thank you again, and enjoy the rest of the summit.